I'm Dr. Jill Vecchio. I'm a practicing radiologist who's actually read the healthcare law. And we're going to go through the Patient Protection and Affordable Care Act in segments. So the first segment we've already done is coverage. The second segment is actually in two parts, and that was on costs. That was a lot of information to cover, so we did it in two segments. This is our third official part, fourth segment on state healthcare exchanges, and then we're going to talk about how this law affects your employer and what the requirements for employers will be. So let's get started. What is a healthcare exchange and how does it work? Healthcare exchanges must be, according to this law, they have to be a government agency or a nonprofit private agency established by the state through these state healthcare exchanges. They can be as simple as a network portal. One, I think it's Louisiana, is using ehealthinsurance.com. That's their healthcare exchange. Costs about $1 million total to set the whole thing up. Most states are planning things, if they're planning them at all, much more extensive, and we'll talk about some of that. The healthcare exchanges have to offer qualified plans only, and we'll talk about what a qualified plan means. They have to approve premium increases. The states can require additional mandates. We talked about mandates earlier, where the states list all the types of coverage that an insurance policy has to have. Any insurance policy sold in their state has to have at least a minimum list of what they call mandates, things that they'll cover. If the states require additional mandates, the states have to pay for it in this law. The employers get to then go to the exchange, and they can choose a plan from the exchange, or the employees can go to the exchange separately. The employers can choose several plans to work with through the exchange also. Now the employees get to make a decision also. They can go through either through one of their employer plans, or they can go directly to the exchange, and we'll talk about what the implications of those decisions are. So who participates in the healthcare exchange? Right now, it's small business employers, somewhere between 50 and 100 employees or fewer, and those numbers are going to vary depending on the states. Some states, I think the minimum right now for federal is 50 employees or less are expected to participate in the state healthcare exchanges. Some states are going to increase that to 100 employees or less. Individuals, as I said, can either go by choice or necessity. In Colorado, out of a population of about 3 million, about 600,000 people are expected to participate. So who pays for the healthcare exchange? This is where it gets a little sticky. The federal government, i.e. we the taxpayers, will subsidize the costs of setting up state healthcare exchanges. Already hundreds of millions of dollars have been divvied out to various state exchanges. Now, some states are refusing to set up exchanges at all. Some of them are taking the federal money and sitting on it, waiting to see what happens with the law, and we'll cover that part of it with the constitutional section later on, so you can see why they might be waiting. But they're still taking the money and filing for the grants to get those federal subsidies, i.e. our taxpayer dollars. So, the federal government will also subsidize the state exchanges, the cost for running them for 2 years. There are a lot of things in this law that the federal government, i.e. us, will pay for or subsidize for 2 or 3 or 4 years, and then it stops. So remember that any federal subsidies for a lot of these programs are not in perpetuity. They stop at one point. So after the 2 years, the states are on their own. They have to pay for these exchanges themselves. Now these are states that are already in financial straits right now, as we know. As I said, some states already have an exchange. Utah's had an exchange that is set up in 2007. They paid $1.5 million for it, and I think it's something like between $500,000 and $1 million, like annual cost to run their exchange. Very inexpensive. They've had it since 2007. So right now, the federal government is subsidizing $22 million in the first segment of their funding. That's a lot of money when some states have just set it up for a couple of $1 million. If states choose not to set up at the exchange, they just say no. And if the constitutional arguments and the 2012 elections go certain ways, the federal government will then be in a position in 2013 to set up an exchange for the states. Now that gets tricky because in the law, I don't know if they made a mistake or if they intentionally meant to do it this way. But the federal subsidies for the state exchanges and for the federal subsidies to help people pay their premium costs for their health insurance policy through the exchanges, only the state exchange participants can get these subsidies. If the federal government comes in and sets up an exchange, then the participants won't get those federal subsidies. So that's kind of a recent glitch in the law that's going to be addressed. So there are all these hot topics going on. The exchanges need to be in place by January 2013. They take effect in 2014. So qualified health plan. This is a basic list. The real list of mandates is currently being developed, so that's more information to come out. So this is basic. All plans have to include emergency services, hospitalization, maternity and newborn care, mental health, blah blah blah. And if you look at this, I mean, I'm 50 years old. I don't need maternity and newborn care. I don't need pediatric care. But if I go through the exchange, I'm going to have to pay extra for that coverage. Is that really fair? That I'm going to have to pay extra for that coverage when I don't really want it or need it? I'm not going to have the flexibility to say, no, I want a plan that doesn't cover those things so I don't have to pay as high a premium. So, what will this mean to employers? So the employers, we saw this earlier, we saw this chart earlier, where we go through the cost of the plan. So let's say an employer does the typical, most employers do a gold plan at 85%, where the employer pays 85% of the premium costs. So that's $19,200 for a family of four. That's a lot of money. So you can imagine a lot of these employers, this is a big increase for a lot of employers. So you can imagine they're going to say, you know what, maybe I just won't offer health insurance to my employees. If they choose not to offer health insurance to their employees, their fines will be between $2,000 and $3,000 per employee if they choose not to offer insurance at all. Now, if they go to the exchange, these are small employers, remember. If they go to the exchange and pick a couple of policies, so they have something to offer their employees. When they hire an employee, the employee has a choice of either participating in the employer's plan, taking one of those plans, or they can go separately by themselves to the exchange and get a policy. If the employee goes separately to the exchange and gets a policy, the employer is fined somewhere around between $750 and $2,000. So, and the employer is responsible or required to notify the employee at the time of hire that they are eligible to go to the exchange and that they may have federal subsidy or state subsidy to help pay for their premium costs if they go to the exchange. This gets tricky. Also, if the employee goes to the exchange and the employer therefore is paying a penalty because that employee went to the exchange, the employer then cannot decrease that employee's hours because they went to the exchange. They can't fire them or in any way punish them for going to the exchange. Now, because of these increased costs to employers, and these small businesses can't afford a lot of healthcare premium costs, so a lot of employers said, we're not going to cover employees at all. There are estimates that between 70 and 80 million people may lose their employer-based coverage because the costs are so high and the requirements for the employers on all this reporting and things they have to do to the IRS is so onerous. So we're dealing with that. Gosh, 70 to 80 million people may lose their insurance altogether. Also, the federal government allowed people to apply for waivers to exclude them from the penalties involved in Obamacare if they offered their own small policy, like McDonald's and some of these places have minimal health care policies that they've offered their employees for years and years. So they said, gosh, if we have to offer this huge list of mandates and so forth and these expensive policies, we can't do it. So, and this is kind of an old slide. It says as of May 20, 2011, the waivers stopped in October, stopped being available. So I think it's about 1,500 or 1,600 waivers have been issued. Most of them to small companies, but about half of those are to unions. Gosh, if I remember correctly, wasn't it the unions who paid a whole lot of money to help get this law passed? About 2.5 million people would be involved. That was with when it was over 1,300 waivers, so it's going to be higher than that. Half of the people that are going to be affected by these waivers are union workers. I thought this was interesting. The entire state of Nevada was issued a waiver, and that's due to medical loss ratio and this insurance company issues that's more complicated than I'd like to get into on these short segment videos. But the entire state of Nevada, that's Harry Reid's state. You remember Senator Harry Reid is, who is he again? Yeah, the Senate Majority Leader who was instrumental in passing this, and his entire state gets a waiver. Interesting. So wait a second. They have to opt out of the plan that was supposed to insure everyone so that they can insure everyone. I hope this clarifies things, and it probably doesn't. It probably makes it much more confusing, doesn't it? So the plot thickens, and it's going to continue to thicken because our next segment is going to be on how this affects doctors and patients. After that, we're going to talk about the judicial and legislative issues, the constitutional issues, and then we'll talk about some ideas for healthcare reform. So I hope you keep watching these. I'm Dr. Jill Vecchio, and thanks for showing up.